Control states that worldwide tobacco use causes more than 5 million deaths per year, and current trends show that tobacco use will cause more than 8 million deaths by 2030. In the U.S., tobacco is responsible for about 1 in 5 deaths per year. For example, about 443,000 deaths and an estimated 49,000 of these smoking-related deaths are secondhand smoke exposure. On average, smokers died 13 to 14 years earlier than non-smokers, according to the Center for Disease Control. I've had family members who have smoked for 20 or more years, and they have quit, so I know that it is possible to quit. I'm also a nursing student, so I care about the environment and the health of others. I also have 2 children, and I care about their lungs and their health, and secondhand smoke affects them. And for some smokers, for some people, smoking is an addiction, and for others, it's not a choice. For those who have to breathe in the secondhand smoke, it's not a choice for them. Some smokers would say that driving a car pollutes the air just as much as smoking does. But I feel that driving is a necessity. If you have to take your children far, travel far for work, or take your children places. They also have environmental friendly cars now, so they don't pollute the air as much. Innocent people lose their lives to secondhand smoke. This is a sad truth. I will discuss in this speech the cons, which there are many of. I will also talk about the few pros there are for the smoking people. I will also talk about the effects indirectly to a person by secondhand smoke and directly to a person by the smoking. I will finish with treatments and effective ways to stop smoking. I will start with the many cons to smoking. Secondhand smoke to adults and innocent children is probably the top con there is to smoking. A lot of children and adults have really bad asthma. Smoking triggers that asthma, and for some people, if the asthma attack is severe enough, or if they don't get medical attention or don't have their inhaler on them, it can cause death. Secondhand smoke is classified as a known human carcinogen, which is a cancer-causing agent, says the U.S. Environmental Protection Agency. Tobacco smoke contains more than 7,000 chemical compounds. More than 250 of these chemicals are known to be harmful, and at least 69 are known to cause cancer, according to the American Cancer Society. According to the American Cancer Society also states about 3,400 non-smoking adults die from lung cancer from secondhand smoke. It is also linked to SIDS, which is sudden infant death syndrome, and that occurs in ages 0 to 12 months. I will go into the pros now. There are very few of them, so I will just talk briefly. The pros for smoking for the smoker would be that it's a stress reliever. It can also be a coping mechanism. If people have hard jobs, or they lost their job, or they're having a hard time in their life, day-to-day struggles, smoking is kind of a way out and a way to keep them not so stressed. So those are ways to that help the smokers. Also, some smokers have stopped smoking for years, and if they have they lost their job or they've lost a loved one, they are quick to pick up the habit again. It helps them. I will now go into the direct effects of smoking. Smoking also causes 1/4 of all deaths from heart disease. Over 70% of smokers between ages 35 and 44 who die of coronary heart disease die prematurely due to smoking, according to eMedicine Health. Also, 90% of lung cancer deaths are caused by smoking and is the biggest risk of other cancers, states the American Cancer Society. In the U.S., 1 in every 4 people die from smoking diseases. There are many side effects to smoking, such as amputations. People get their fingers amputated, their toes, and then from the knee down amputated their legs. It also causes COPD, which over time your lungs fill up with fluid, so you essentially drown in your own fluids. It causes emphysema, heart problems, heart attacks, and strokes. Strokes are a very severe problem if you don't get medical attention right away. It causes many cancers, throat cancer, gum cancer. It can also cause lung cancer, which is the #1, and it's also linked to other cancers. And it also causes gum disease. Smoking during pregnancy is sad, but it does happen, and it's very harmful to the unborn child. Premature death, it causes premature death, premature delivery, a low birth weight, SIDS like I spoke about before, learning problems, and ADHD. Obviously, the more cigarettes the mother smokes, the more harm it causes to the baby. I will now talk about the indirect effects of smoking. The indirect effects of smoking are the result of secondhand smoke. According to WebMD, breathing in secondhand smoke is bad for you, bad for your heart, and research shows that it takes as little as 10 minutes for the smoke to start causing damage. Children are very vulnerable to secondhand smoke. Since they are still growing, they breathe at a faster rate than adults do, so they essentially breathe in more of the toxins than an adult would. Conditions linked to secondhand smoke are SIDS, like I talked about before, an increased number of respiratory infections such as bronchitis, more frequent and more severe asthma attacks, ear infections, and chronic cough. I will talk about the treatments and effective ways to stop smoking. There are many products out there today that smokers can use to stop smoking or to try to stop smoking. There are a lot of gums to chew. You can wear patches. You can also combine the two, and you can have a higher success rate of stopping the smoke. There are many support groups out there. If you go to a support group and you find someone else, you can befriend them, and you can get their number, and if anytime you feel that you're going to take a cigarette or go smoke a cigarette, you can call them and they can get your mind off of it. There are also therapists out there that you can talk to if you're having more issues or if you just need someone to talk to. There are activities you can do in place of smoking, such as going for a jog, going swimming. You can get a cat, plant plants, all kinds of activities that there are instead of smoking. I have also known people who have put mints in every time they wanted to smoke. Also, lollipops are an effective way. A lot of people, it's the same kind of putting in and out of your mouth and having that something in your mouth like smoking. Another way to think about smoking is the cost. It would make me want to stop. On average, a smoker on average spends about $2,400 a year, which is a huge expense, an unnecessary expense. You could save that up and at the end of the year go for a family vacation or treat yourself to something nice. There are also other activities you could be doing instead of smoking that are more beneficial to you and the environment. Remember when picking up a smoke that you're not only affecting yourself, but the people around you, and even worse, you're affecting innocent children and babies. I hope this speech has made smokers out there want to not smoke. It's hazardous to yourself and to everyone around you, and it's a huge expense, and